Hello, friends. I'm Sharon from Natural Awakenings magazine, and today we are talking to our good friend, Dr. Julie Monaco. Once again, Dr. Julie is the author of Diets Don't Work, Understanding Your Food Does in the December issue, which is on stands now. So get to your local health food store and pick one up. And let me switch views. Hello, Dr. Julie.
Hi, Sharon. How are you?
Doing well. How are you?
Wonderful. Good to see you again after the holiday, all intact, ready to go.
Yes, and I was pretty good at not eating bad things, so thank you for the inspiration.
Oh, you're so welcome. That's good, right? It's all good.
Uh,
Um,
So
so
today,
today, what's
sorry,
that? I'm
I was going to
sorry.
say, so
Hi.
today you're going to educate us on some symptoms that some of us might be experiencing from all of the variety of wonderful treats we're tempting ourselves with this holiday season.
Exactly. That's exactly right. So what I had come up with to do a little bit of information sharing as we do here is to talk about GERD flares. And as I said that to you, you said, what is that? I said, oh, I better explain what that is. Now, everyone knows what it is. I just have to match what you know to what I'm saying. GERD stands for gastroesophageal reflux disease. So do we all have that disease? Well, remember, disease means dis-ease. We are not at ease with our bodies. So don't forget that, D-I-S-E-A-S-E, dis-ease. And yes, this is a real common one. And right now, I think it's extremely topical. And when I told Sharon, she was like, oh yeah, okay, let's do it. So let's jump into this. Understand, let's just talk about some of the frequent causes of reflux, okay? So and the mechanism. When you swallow food, okay, there's a circular band, a muscular circular band around the bottom of your esophagus, and that's the tube that goes all the way down. It's the esophagus, the one the food goes in, not the one you breathe through, which are bifurcated here somewhere in the throat area. So what happens is the lower sphincter relaxes to allow food and liquid to flow into your stomach, and then it's supposed to close. Food into your stomach, it's supposed to close. So what happens is obviously in some cases, and lots of doctors still say this, it doesn't close properly or it's damaged. And yes, that can absolutely happen. Though there's many other things that are happening between our mouth and between just above our stomach in that esophageal area. So some of the signs that we might have to kind of indicate that we have what they're calling GERD, the gastroesophageal reflux, okay, is this is where we all kind of connect, okay, is that's a burning sensation in your chest or heartburn after eating, which might be worse at night. Why? Because when we're home after work or even in the holiday, we tend to eat more in the evening, and we're reclining, we're laying down, and so this can not get down into the stomach and not be, we're not doing our proper digestion stuff. It lays around, and this can bring on those symptoms. There can be a regurgitation of the food or sour liquid, sensation of a lump in your throat, if you've ever had that and thought, oh my gosh, why am I eating normally what I eat and I'm kind of feeling like I can't swallow it? That could be GERD, okay, reflux disease, and you don't realize, and you almost feel like you're choking. I've heard that many times. If you have nighttime reflux, what they say typically is you also might experience chronic cough, laryngitis, like, I don't know what's wrong with my voice lately, or the breathing, like you would have a chronic cough. And they're also talking about new or worsening asthma. So think about that. Back in the day, if it's asthma and laryngitis and things up in here, speaking and breathing, we're not really connecting it with a problem of food that we're eating. But yeah, and that can really come from the fact that we're sensitive just to the food and add to those symptoms. And also remember, if you're sensitive to it, as soon as you eat it, it's going to inflame and irritate that tissue. So those are some new things that doctors are finding that they were a little bewildered about before. And I do see this a lot for sure. Remember too, if in all this talk, if you're experiencing these kinds of things and you're experiencing them more than 2 times a week, and you're taking medications for it over the counter, and you're also doing that 2 or more times a week, maybe it's time to have a follow-up with some sort of practitioner. So let me just throw that in there. risk factors. What makes this condition even worse? And you see, I'm going to say something right now. As I speak about any condition, or as we speak about health in general, what as you see happening, if you're watching our videos, is that so many things connect. So what do I mean by that? Well, listen to some of these factors that are not good for this situation, this disease, but for so many other things. That is obesity, bulging of the top of the stomach, which is called a hiatal hernia, connective tissue disorder, or scleroderma, or lupus. Okay, delayed stomach emptying, where the stomach is full, therefore there's a backup where it would stay. Yeah, right. So yeah, and that's going to happen because you have generally not a good digestive system going on, not a good GI situation. Let's see, anything else? Also pregnancy, did I say that? Okay, so what do those have in common? They're all restricting that tube. So let's just say you have a hiatal hernia, and if you don't know what that is, there's a muscle, if you will, a very thin muscle that goes right across the middle, okay, kind of like at the bottom quarter of your ribs. So what happens is you can have a hernia just like in any other muscle, and something might pop up through that, typically a portion of your stomach just a bit, and that's right next to the esophagus, and that would smush it. Pregnancy might smush it. Anything that compromises the tube, if you will. Okay, we know that. Those things, though, should come and go. Hopefully, you can get that hiatal hernia managed. Pregnancy comes and goes. So these things are temporary, but they do exacerbate the situation. And sometimes people don't even feel anything like a GERD situation until they get in those conditions of life. Let's see, what else is on here? Oh, so I just spoke about it. So what they talk about over time, chronic inflammation of the esophageal can cause the esophagus, and that's over time when we're having the restriction from one of these things, or we're having the tissue and what we're eating is causing the acid to either come back up, that sphincter at the bottom is not closing properly, or just because we continually bombard the esophagus with not food that it's harmful to the tissue. We do that. Damage to the lower esophagus from the stomach acid can cause scar tissue. So that the tissue actually gets scarred. So then it's not performing its duty, and it doesn't have the ability to, the sphincter also has a muscular situation where when you swallow, you're like, that's such an amazing thing. It just takes my food like a little conveyor belt right down to my stomach. Well, that can get all not be in a good situation and kind of impact upon that. You can get an ulcer, obviously. You keep doing that, and you can get an esophageal ulcer. And there's something called Barrett's disease, which I've seen more than I thought I would see even to this point. And that is the tissue does change, and they call it a precancerous condition. And I've had very young people tell me they were diagnosed from the GI with Barrett's esophagus and are here in our office because they couldn't really find, thank God they didn't get to an ulcer situation yet, or they couldn't really find anything going on. But what's the deal? It's food, everybody. It's food. So with that said, let me see what else is here. Some of the factors too, like I talked about what tightens the esophagus. So some of the factors that you can well imagine that aren't going to make our tissue happy, and it's going to add to the irritation of this esophageal area is, of course, is smoking. It's eating large meals and eating late at night. Eating certain food that trigger you, as fatty or fried foods, definitely a big one. I hear it every day. Drinking certain beverages such as alcohol or coffee, can't say enough about that. Because we're just doing it and we're drinking that, it's offsetting the balance of taking in water. So on top of it, we're a little dehydrated. None of our cells are happy when we're dehydrated. And so that also sets off, like they're saying, conditions that actually aggravate it. And taking certain medications such as, believe it or not, aspirin. Aspirin, they mention because it's so widely taken, and it really is an acid, if you will. Anything acid. Because remember, what are we taking? What are we grabbing for when we have these conditions come upon us? An antacid, like a Tums or something. We'll give a shout out to Tums because basically you can find it anywhere, and it's made out of calcium carbonate mostly, and it really does work in that situation. So that's what we're talking about, those kinds of things. Let me keep going. So I think I spoke enough about what it is in that irritates the tissue lining, and then what also can be a predisposing factor. Let's talk a little bit about, and this is what I just wanted to get to, what can you do, okay? And again, remember, we're just you're not in treatment and you just are, noticing that you've got this condition. What can you do to truly make it better that works? Okay. What you can do is you can discontinue your triggers. Everyone is different. You might be on a medication. Okay. And actually, let me go back to that. Excuse me one second. Let me, just because I was a little surprised myself. All right. Let me read off this list that I pulled out. Okay. Anticholinergics, right, which is for overactive bladder or irritable bowel. But think about it. It's for the same type of sphincter action, overactive bladder or for your bowel. These are the same kind of muscle, thin muscles that you have also associated when you talk about your esophageal and that bottom sphincter. So these things are to control it. So if you're taking them for something else, they might have an impact on that sphincter and kind of, not have a good impact, and therefore you're left with problems like the reflux disease. Antidepressants, calcium channel blockers, ACE inhibitors, narcotics like opioids, progesterone, sedatives like Valium, and theophylline. So there is also a drug-dependent issue going on here as well. And then they're just like I said, that can mess up how the sphincter is working. It can slow it down. It can make it not as effective. Now, come into the other part, what bothers the tissue. And what bothers the tissue as far as a medication or even a vitamin would be these antibiotics, extremely acid, such as tetracycline, of course, bisphosphonates. Okay. Now, when I say a bisphosphonate, those are the meds that, if you will, thicken up our bones. And two examples of those would be Boniva or Fosamax. Okay. But when I say them, they really include the whole, all of them. And so you really kind of want to question or have a conversation with your doctor and see if two are related, especially if you're having a lot of trouble with reflux disease. Potassium supplements and also iron supplements can be irritating, and both of those are acid. They're more acid than, certainly, as we mentioned, I'll go the other side of the gamut, the calcium carbonate, which actually cools down the, it's almost like chalk-like. Calcium carbonate is kind of like chalk. So think about it this way. If you took powdered chalk, right, and you had on your driveway a bunch of oil, you say, well, I'm going to just throw powdered chalk on there, kind of pat it down, and then I'm going to sweep it away. You would think, oh, that's going to sop up some of that oil, right? Well, that's kind of the same idea, and that's kind of what happens when you take something like a Tums. Okay, so it can be from medication, it can be from irritation, it can be from eating too much and stretching the tissue out, it can be from smoking, which you're inhaling, and even though inhale, it's air and it goes more in trachea area, lungs area, it's right there, it's still getting some of that toxic stuff from the smoke. So I think you get it. It's susceptible to so many things. And I'd like to say we're stopping and we're turning around and we're going to do better, but we need to have some of that information. Okay, so we started out by saying this was going to be kind of a quick kind of what you can do, and especially around this time when people tend to eat a little different than they usually do. So first and foremost, everybody, discontinue those triggers. So for somebody, it might be fatty meat, okay? And the combination might be the medication they're on and the fact that fat does it to them and really irritates their tissue, and they're a little dehydrated. So whatever is yours, let's not diagnose it, just stop it, because you're not really going to know, okay? And everybody has perhaps medication that they're on, or a lot of people do. You just want to make sure that you have an even, and you can swallow, and an even balance when you're trying to digest. And it starts here in the mouth, everybody, digestion. Okay, eat less volume. They said it already. What can trigger the tissue? What can really irritate it? If we eat too much at one time, it's almost like you're scraping it, if you will. So let's eat less volume. Drink enough water. I know I'm talking about this, but what does water have to do with it? Stay hydrated. It has to do with so many things. So you're staying hydrated, eat less food, get out the trigger. Something bothers you, don't eat it. Alkalize your diet. Okay, now I said this was going to be quick, and it is, but just let me give you some hints that you can start to think about anyway, okay, for maybe a longer term or more integration into your diet as a whole. You want to stay more alkaline than acid. So the problem is that everybody I test is acid. And anybody in my shoes who's testing patients for their alkalinity or their acid component of what it is that their system is, you're going to find in the 3 and 4s most of the time. We want to be up around 7. The scale goes from 1 to 14, okay? And we should be in the middle. So how do you do that? Go ahead.
How accurate are the strips that you go to the bathroom on?
They're a good guideline. They really are. The thing that's frustrating, and maybe you've experienced this, unfortunately, it takes a lot to change them. Yeah, it really takes a lot to get out of that yellow, to get into that nice green area. So it really takes some concerted dietary effort to do it. But I'd say that's a good guideline for many reasons. It makes you think, it's consistent, it's there, and you're measuring, right?
Mm-hmm.
So with that said, that's great, Sharon. And that is a way you would test it, okay, everybody? She's talking about the strips that you buy from anywhere, Rite Aid, anywhere, and you can use them. And it comes actually with a little bit of a scale.
Mm-hmm.
And the scale I just mentioned, you can see where you fall on the scale. So let me talk a little bit more about that. You want to move that way. So let me give you some of the big, a couple of the big things we can think about. If I said to you, what do you think is the most alkaline food? All right, I'm going to answer, but you probably know the answer. It's going to be your fruits and vegetables, not your beans, not your wheats, not your grains, and not your meats. Okay, big, just a generality. What's next? Which of fruits is the most alkaline? Now we think, oh, well, lemons and limes, they're just acid. No. The more tart, the lemon and the lime is the most alkaline thing you can eat. People are always surprised. They have to go look at it. The reason is that the tartar they are, the more, and grapefruits are up there, and the citrus is up there. Now, if you can't tolerate it, going in, it's acid. When we call in our field ashes down, and it becomes part of the system in your blood, it adds to the alkalinity. So it's a little bit of a concept that you have to get used to. So if you're going to eat an apple, you could kick up your alkalinity by choosing maybe an orange. You see what I'm saying? So that's something to think about. The same thing with bitters. People are familiar with bitters. Well, bitters come from a very citric kind of concentration, and you sip them and it makes your gut feel better. So all of these things have been around for a long time. Another one, I'm going to say, animals are acid. Yep, animals are acid. What does that mean? Your yogurt, your milk, your meat, it's all on the acid side. Because we think of milk being so benign. Oh, I'll just have a little glass of milk. It'll settle my stomach, or it's white and fluffy and creamy. It's acid, everybody, okay? So the idea is to understand, like I said, if it's yogurt, if any form that it's in, it's going to be on the acid side. So, couple of things. When you and I've been asked this many times, when you do kind of, instead of the milks and instead of anything that you can trade over for an almond, a coconut, or a nut type of thing, go for it, because it does decrease the acid and let the alkalinity shine a little bit. So that's a help, okay? And fish. Let me just talk about that. And you could figure this out on your own. Fish is a little less than meat and beef. It's a little less acid. So you might choose that twice a week. So all of this information, and I'm kind of putting it together with the GERD situation, is not very different than what we talk about in so many things we're trying to do better. So let me lastly say about products, okay? So one product, we talked about Tom's a little bit. It's out there. You can find it. It helps. If you wanted to find a product that's really good, okay, you want to find a product that has 3 major ingredients. One is calcium carbonate. The other one is diglycerolized licorice, DGL, okay? And the last one is slippery elm. So you're going to find, if you go out and you Google or you go to your favorite place for vitamins and you want to find something, they might have two or other things in them. Some of them have algesic acid, which is also very good. So what I like about these some of them are like herb-like supplements. They're going to heal this area. So it's going to give the membrane in here a little bit of something to be able to kind of make it better. And it's going to cool it off, if you will. And if you do it in between, if you do it when you're having an episode, they really are relieving. So take it when you've got something going on. But then if you find one of these that has the diglyceride licorice and the algesic acid and the DGL and even the calcium carbonate, this can build back the tissue a little bit. So I suggest these even in between. So last word about what we can do. Apple cider vinegar. So because people ask me all the time, is that good for weight loss? And it's been so connected with so many things. This is where it shines, everybody, is to alkalize your system. Vinegar, everybody thinks it's acid. It is. Red wine vinegar, it actually goes across the spectrum. If anybody pulls up an acid alkaline chart, you'll see vinegar go across the spectrum. But one of the most alkaline things you can drink is apple cider vinegar. And since you drink it, it's in liquid form. We can find it. It's relatively very inexpensive. You chug it down and you're going to give your body a good shot, if you will, of alkalization. And that's, I think, the way it's connected to weight loss, if I can do that, is that if your body's in a better state, a more natural state to be running on, it'll burn fat better. But this is the most wonderful way that I, as a clinician, use it and think it's used, and that is to upgrade your alkalinity. Never drink it straight, everybody. You must cut it. Water. And then there's recipes out there, nice recipes with a little bit of apple juice, a little bit of cinnamon. So look them up. Please don't drink your apple cider vinegar by itself. It's so base. It's like, what's the most basic thing? What would kind of burn you? You wouldn't stick your hand in ammonia. That's what I'm getting at. So it just like its cousin on the other side, you wouldn't stick your hand in acid. So it's very powerful and it's very strong. It's very alkalizing. So you can do that. So if you started to do it and you were like, well, I'm running around to all the stores and I see all those little apple cider vinegar shots and they've got the lemon juice and I'm going to take one a day. Oh boy, would you be doing something for your bottom line? You really would. So I hope those little tips help. They're fast, they're quick. It kind of gives you a little perspective of how you get there, what it's all about. And those things can be done just as you're running around. And you haven't really committed maybe to something to change, but this is a little bit of change that can help that GERD. And that's what we have to say about GERD.
Well, I certainly learned a lot.
Oh, good.
And so anyone who is suffering from issues like this, Dr. Julie, what is the best way for them to reach out to you?
The best way to get a hold of me is you can go to our website. That's drjuliemonica.com, or you can reach us I'll give you a phone number at 732-685-3171. And that's the office number.
And you are extending a free 25-minute consultation for anyone who wants to explore these issues with you. Is that correct?
Yep, because people have so many questions and what nutrition can really, how it fits into their healthcare, what it can do, how it impacts their condition, what they're suffering from. Perhaps their doctor told them, I'm getting a lot of referrals to seek out a nutritionist. So the answer to that, Sharon, absolutely yes.
Outstanding. Well, thank you, Dr. Julie. I'm going to go downstairs and add a shot of apple cider vinegar to my water.
There you go. There you go.
I appreciate your time once again, and thank you for being here. And please, everyone, give us a like, share. If you have comments, leave them below, and we'll be joined by you again soon. Yes?
Absolutely.
All right. Have a great day.
Bye, Sharon.
Bye-bye.